Are you constantly checking where the bathroom is? Maybe you've been to see a medical professional and been told that everything looks normal, but it certainly doesn't feel that way. If your bladder is running your life, let's talk about something that many doctors don't discuss: interstitial cystitis. Why do we need to talk about this? So many women are struggling with bladder issues. They feel locked in their house because it's difficult for them to go out because they need to know where the bathroom is. They may not be willing to go out and meet friends for coffee or dinner because they're constantly having to run to the bathroom. And going on a long road trip is just literally impossible. So we need to discuss as women a real conversation about what's going on. And we're also going to discuss what the difference is between interstitial cystitis and normal incontinence. Now, let me explain that little air quote around normal incontinence, because so many women are told that dealing with incontinence either as you age or after you give birth is just normal. Now, I understand that many women do struggle after childbirth or as they age with incontinence, but just because it happens often does not mean it's normal. You do actually have the capability to be able to maintain continence even as you age and after childbirth. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I hold a PhD in orthopedic manual physical therapy and strongly believe that movement is life, and you deserve both. So let's discuss what interstitial cystitis actually is. The definition of it is a chronic inflammation of the bladder wall, which means the inside of your bladder wall is actually chronically inflamed. And this is not caused by an infection, which means it's not relieved by antibiotics. Many people will have interstitial cystitis, have been diagnosed with urinary tract infections repeatedly over time, and they take the medication, which seems to resolve the symptoms for a little bit. However, it repeatedly comes back. In fact, this is how many people I know realize that it's interstitial cystitis. The other thing that it's diagnosed as is an overactive bladder, which is basically the same thing, except for it doesn't have that inflammatory component to it. So who is affected by interstitial cystitis? Well, primarily women. It often can occur after a trauma, childbirth, or with hormonal changes that occur over the lifespan. These women are frequently misdiagnosed and set aside by the medical system when the medications that they're offered don't work. And how they end up in my world is that it is often linked to other pelvic floor disorders. So many women with interstitial cystitis will come in for pelvic floor physical therapy because they have another issue, such as a prolapse or pain with intimacy or constipation that is common pelvic floor symptoms, and really they're also suffering with an interstitial cystitis at the same time. How do you know if you have interstitial cystitis? Well, if you're suffering with urinary urgency and frequency, this may be a diagnosis to consider. One of the biggest symptoms to know if it's actually interstitial cystitis, though, is that you will have increasing pain in your bladder as it's filling, as the urine is accumulating in there, with relief temporarily after you urinate. Many women report discomfort in their lower abdominals or in their pelvis, and this is even before there's any symptoms of a prolapse or anything more advanced. And they also have pain with intimacy or even when inserting a tampon. I would say the second biggest sign to know that what you're struggling with is interstitial cystitis is if you've been treated for a UTI with antibiotics that did not resolve the problem. I would also ask you to consider this diagnosis if you have frequent repeated UTIs that seem to get better for a short period of time after the medication. Now, obviously, when you are struggling with any type of incontinence, and especially interstitial cystitis, where you're going to see repeated doctors, you're having repeated visits, and you're not getting the results that you're looking for, this increases your stress because you don't know what's going on and you don't know what to do about it. Well, of course, this stress makes your symptoms so much worse. And it's really, really frustrating for people because they're constantly trying and hoping and looking for a solution, and they're not getting it. And the stress just keeps escalating and escalating as the symptoms progress. This puts them into that fight or flight response, right? Because this puts them into that fight or flight response, which causes all these other issues because everything's going to tighten up, including your pelvic floor, making any pelvic floor symptoms you have worse as well. So one of the important things that I need you to focus on, if you have interstitial cystitis, if you have any sort of pelvic floor dysfunction, or even if you're struggling with urinary incontinence, is to make sure that you're practicing your deep breathing exercises. When you're doing deep breathing, you're activating your diaphragm, which is the big muscle that helps you take those nice deep breaths. Now, the really cool hack that goes along with that is that when you're activating that diaphragm, you're also getting a massage that is affecting the vagus nerve. The vagus nerve is fantastic because it helps pull you out of that fight or flight response, and it brings more blood flow and stimulation to the other organs, including the bladder. So doing that deep breathing will, to get you out of that fight or flight response, activate that vagus nerve and help bring more blood flow and a response to the organs in the abdominal cavity. I'm not saying that deep breathing is going to cause I'm not saying that deep breathing is going to solve all of your symptoms, but it is going to make a significant difference on a day-to-day basis. Now, before we discuss more tips of what you can do about it, if you're liking this video so far, give it a thumbs up. Don't forget to subscribe for more content related to women's health. So what do you do about interstitial cystitis? Well, the first thing is you don't take antibiotics. If you've already taken them, you know they don't work anyway, so you don't have to worry about that. And a lot of people are told to do bladder retraining. Well, you can't do bladder retraining when there's actually something going on within your bladder, this inflammation. So that usually doesn't work, which increases your stress because you're trying to do something about it, and it's actually not helping solve the problem. But here's some things that will start helping you to feel better on a day-by-day basis. We already discussed that deep breathing and the importance of that. I'm going to link a video here. If you've never heard of deep breathing, it'll help get you started on your deep breathing journey. We want to make sure that our posture is in the correct position. So when we're sitting, our head should be over our shoulders should be over our hips. If we're standing, our hips should be over our feet. And we want to make sure that that SI joint is in the proper position. Now you may be wondering, how do I know if my SI joint is in the proper position? What you can do is, standing in front of a mirror, put your hands on top of your hips and point your fingers forward. See if they're pointed in the same direction. If they're off one way or the other, then you probably have an SI joint malalignment issue. Now, we have a video over here that you can watch to help improve your SI joint alignment, but if you can't get that resolved on your own, I am going to recommend that you see a manual physical therapist to help restore normal pelvic alignment and decrease tension through all the muscles, including the pelvic floor. Speaking of the pelvic floor, please stop doing Kegel exercises. If you've been told to do Kegel exercises to heal your interstitial cystitis, I'm going to have you watch this video over here of my favorite exercise to do instead of Kegel exercises. However, pelvic floor physical therapy can be very helpful if you're suffering with interstitial cystitis and a pelvic floor dysfunction on top of that. And at this point, you may be saying, well, do I need a manual physical therapist or do I need a pelvic floor physical therapist? And the truth is that you may need both. And ideally, that would be found in one person. It is really helpful to have one person who can not only treat your pelvic floor and get your SI joint in alignment, but help look at you as a whole person, a very holistic point of view, to understand what your body needs to decrease stress to the bladder in order to improve your interstitial cystitis. Now, another thing that you can implement right now at home is looking at any dietary considerations that may be aggravating your bladder. Now, this can be really, really difficult because you may not know what it is. And you're like, I haven't changed anything over time. However, we can become allergic to things over time, and we can become allergic to things as we age. So if there is anything that you know, hey, every time I drink drink this or I eat that, I feel like it makes my symptoms a little bit worse, I'm going to ask you to take that out of your diet for 1 to 3 weeks and see if it changes your symptoms. I understand that this is a slow progress and you're not going to necessarily see any changes right away, but removing any irritants can really help to decrease your symptoms. Now, if you think, oh, okay, there may be like 3 things that I might be causing the problems and I really want to deal with this and do everything I can, I would remove all 3 things. I would do that for 3 weeks, see if it's improved your symptoms, and if it has, then I would add back 1 thing at a time to assess if it really was all 3 things or if it was just one of them. And another thing that can be very helpful with interstitial cystitis that you can do right now is performing gentle movements and not sitting for prolonged periods of time. Even getting up from sitting every half hour or hour and walking around your house or your office for just a minute or 2 can really help to decrease your symptoms of interstitial cystitis. Our clinic, we also have some advanced healing techniques specifically for interstitial cystitis. It's called Shockwave therapy, and it helps to stimulate healing at the cellular level. So in regards to interstitial cystitis, we have created a STEM for Everybody protocol that actually helps improve blood flow to the bladder and the pelvic floor, reduce fascial tension that's surrounding the bladder, which helps to decrease pain and the frequency of symptoms. The awesome thing about this is it's non-invasive. We do it actually over the abdominal cavity, so over the front. We don't have to go in through the pelvic floor or anything like that. There's no drugs involved with it, and there's no downtime. You can literally leave the clinic and get back to the things you love. If you're interested in Shockwave, but you don't live in the Maple Valley, Washington area, I'm going to include a phone number for someone you can call to find a Shockwave provider near you. Now, this person works for CureMedics, which is the machines that we have in our clinic in the United States. So I highly recommend, if you're going to work with a Shockwave provider, that you call this number and find one near you. So when do you know if you need to see a specialist? If your symptoms are persistent or they're getting worse. You've been told there's nothing wrong, but you continue to suffer. Or you want to explore holistic options that get to the root of the problem. And that's how one of our patients found us. We're going to call her Jane in order to keep her anonymous for today, but she came in and she was struggling with interstitial cystitis. She also had constipation. She had pelvic floor tension. She had a ton of glute tension, and all of these things would interact and affect her throughout the day. Sometimes she was running to the bathroom. Sometimes she couldn't move because of the glute pain. She definitely felt controlled by all of these issues, but she also felt like all of these issues were playing off of each other. Now, Jane did have a pelvic malalignment issue, which was putting undue stress on the glutes, as well as the bladder, as well as the pelvic floor. So we took a 2-pronged approach with her. We did manual physical therapy to help improve her alignment, to decrease the muscle tone in her glutes, as well as some other muscles, and decrease the tension in her pelvic floor, as well as doing shockwave therapy on her abdominal cavity to deal with her interstitial cystitis symptoms. And the 2 worked together beautifully. By the time we were done, she was no longer having to run to the bathroom anymore. She was not getting that horrible glute pain at night. And she was able to return to doing all the activities that she loved without any issues. When we sent her on her way, it was really awesome because Jane said to me, "You've given me my life back. I literally don't have to consider where the closest bathroom is, if I can do this, if that's going to aggravate that." She's like, "I can just plan my life and do what I want to do without having to worry about all of these symptoms coming back." And it is so awesome to see people regain the freedom to feel like they can leave the house and they don't have to plan their bathroom stops before they go. If this sounds like you or someone you love and you are in the Maple Valley, Washington area, I'm going to encourage you to reach out for a free discovery visit. If you're not in our area, we do offer online health coaching, and we can go through, hear your story, and help answer your questions specifically. If you want to find a Shockwave provider near you, I'm going to link that phone number for Curamedics down in the description box. I highly recommend you call them so you can find a Curamedics Shockwave provider near you. Again, these machines are the only ones that are FDA approved in the United States, and I think it's really important to make sure you know that the machines are working correctly. And if you want to learn more about Shockwave, I'm going to put a video right over here.